Good afternoon, ladies and gentlemen. On behalf of JBM Global School, I, Krish Mehta,
And I, Riya Srivastav.
welcome you all, the parents, teachers, and students, to today's webinar on oral health and well-being, an interactive session with our esteemed guest, Dr. Siddhi Tripathi. Ladies and gentlemen, JBM Global School has been regularly conducting such webinars for the betterment of the parents and students, which includes good mental health, proper eye care, know yourself, and so on. So, continuing this trend, JBM brings you yet another webinar today, featuring Dr. Siddhi Tripathi.
Did you know that your oral health often offers clues about your overall health? Or that the problems in your mouth can affect the rest of your body too? Why do we still take it for granted and ignore oral health and wait for its severity? Oral health is fundamental to overall health and well being. A healthy mouth enables people to eat, speak, socialize without pain, discomfort, or embarrassment. Ladies and gentlemen, the impact of oral disease on people's everyday lives is subtle and pervasive, influencing eating, sleep, work, and social roles. Good oral health has many benefits, not only for your mouth, but your overall well being too. Dear parents, taking good care of your oral health goes far beyond keeping your teeth and gums healthy and also improves your quality of life.
Dear parents, it gives us immense pleasure to announce that the senior consultant and professor at the Department of Prosthodontics, Dr. Siddhi Tripathi, is already here with us today. Ma'am, you are a specialist in dentistry and prosthodontics, winner of the Best Scientific Paper Presentation Award at the 48th Indian Prosthodontics Society National Conference, and working as a senior lecturer in Courteval Dental College and Research Center. Ma'am, you have been working towards the well-being of overall health of both adults and children.
Ma'am, we feel glad that your presence will help and guide us for oral health and well being. You have been practicing this noble profession with utmost dedication and sincerity. Dr. Siddhi Tripathi is here to discuss the problems associated with oral health and well being. Dear parents, we will hold a question answer session after her address. Here, let me remind you all that this is an interactive session. Ma'am would be delighted to answer all of your questions, so make sure to note them down and ask them in the live chat. I now request Ma'am to kindly address the audience.
Thank you. Thank you so much. It's my proud privilege, and I'm really humbled by the importance of oral health that has been delivered by both of you. And I thank the entire management of JBM Global School for giving me this opportunity to express my views in front of all of you, the teachers, the parents, the students. And I really hope it changes your attitude regarding the oral health and how it affects our overall health. So I'll be just sharing my screen. Just give me 1 second.
Of course, Ma'am.
Can you see my full screens, all of you?
Not yet, ma'am.
Perhaps it's loading.
Yes, ma'am, it's visible.
Is it visible?
Yes, ma'am.
All right. So let's jumpstart straight to the topic, oral health and well-being. So, what exactly is oral health? What do we all understand by it? And why is it important to all of us? So, basically, in professional language, I would say it's a reflection of our physiological, social, and psychological factors that are essential for our quality of life. Good oral health is important so that we can eat and drink comfortably, we can speak and smile with confidence, and we are free of any kind of pain and discomfort. Now, remember, friends, we need to understand that our oral cavity or our mouth is a host of millions of bacteria, both good and bad. And in absence of regular mouth care and oral hygiene, the number of harmful bacteria multiplies, and that can affect the rest of our body. So it's high time we realize that our mouth is not disconnected from the rest of our bodies. The same blood flows through all of them, the same nerves goes through them. So to have a healthy body, you need to have a healthy mouth. Now, before going ahead with all kind of common dental problems, let us first understand what a tooth looks like. So basically, in the oral cavity, you can see two parts of a tooth. One part that lies above the gum is called as the crown portion, and the one that lies below the gum line is called as the root portion. Now, just like if you've seen a tree with widespread roots, how it provides foundation to hold the tree in place. Likewise, the roots of your teeth hold your teeth firmly in the mouth. Now, going a bit further, if you section a tooth, you can see three basic layers. The topmost layer is the enamel, followed by the middle layer called as dentin, and the innermost layer called as pulp. Now, if you can see in the diagram here, now enamel is the hardest, outermost protective covering of our body. It's even harder than bone, mind you. And with its incredible strength, it can withstand the powerful forces of biting and chewing every day. Now, dentin is the second layer that lies underneath the enamel and comprises millions of microscopic tubules called as dentinal tubules which surround the pulp and plays a pivotal role in communicating sensations from the surface of your teeth to the nerves inside your teeth. And mind you, friends, without your dentin, you will not be able to distinguish whether it's a cold ice cream or a hot bowl of soup. The innermost structure is called as the pulp. Now, this is the structure which holds your vital nerves and blood vessels, and it is the living part of this is how it is connected to the rest of the body by virtue of your, as you can see, the blood vessel as well as the neuronal network. Now, if you talk about the sets of teeth, there are two sets of teeth in our lifetime. The first set that our babies get is called as the milk teeth or the primary or the deciduous teeth. Now, these usually erupt around, let's say, 6 months to 2.5 years of age. And they are 20 number, as all of you must have read, it's a commonly known thing. But the thing you have to understand is the enamel, that is the outermost covering of your enamel, of your primary teeth, is very thin as compared to the permanent tooth enamel. The thickness is less, so definitely it is more prone for decay. Now, the second set is the bigger, the stronger, the permanent teeth, which usually erupts around, let's say, 6 years of age. And usually till your second molars, they erupt around 12 to 13 years. And the wisdom teeth usually erupts late, let's say around 17 to 25 years. Again, it's variable from person to person. Now, with proper care, your permanent teeth can actually last for a lifetime. Now, if you look deeply at the teeth structure, you can see that the primary teeth is designated by the notation A, B, C, D, E. So A and B stands for your incisors, which will be later on replaced by the permanent incisors, the central and the lateral incisor respectively. This is followed by the cornerstone of the mouth, that is your canines. Okay, followed by your molars, replaced by premolars in your permanent teeth. Your molars do not have any predecessors. They are not called succedaneous. These remaining set of teeth are succedaneous teeth, the 20 primary teeth that are replaced by 20 permanent teeth. Those are succedaneous teeth. And the remaining 12 molars, 3 in each arch, each quadrant, upper 2 and lower 2. So those are non-succedaneous teeth. That means they will erupt only once in a lifetime. Okay. So we have to be really careful about the maintenance of their health and longevity. Now, when you talk about wisdom teeth in particular, okay, the last molars are called as wisdom teeth, and usually we don't have enough space for them to erupt. So because of this, they may erupt in a wrong position, or they may not erupt at all. That is when we call the tooth as impacted tooth. Okay. So see, if you see the evolution of humans, right, from Australopithecus, Neanderthals, and Homo sapiens, if you see, the jaw size has considerably decreased. See, initially we had more of fibrous raw diet, okay, which required a powerful masticatory apparatus, and definitely your jaw size was bigger. Now, gradually, as humans have evolved, we have switched over to softer diet, cooked food. So definitely with the evolution, our jaw size is also receding, and therefore usually the last molars, they don't have enough space to erupt. And that's the common reason we might have to go for extraction in most of the cases, because they don't find sufficient space to erupt in the oral cavity. Now, with this basics in mind, let us look across the common dental problems which are being faced by kids and adults. All right. So moving ahead with the most frequently seen problem cavities in layman term, in dental terminology called as dental caries. So what are these? These are basically visible holes or pits in your teeth. And how is it caused? It is caused by plaque. What is plaque? It is an invisible film of germs that constantly grows on your teeth. Now, if you rub across your tongue over your teeth, don't you feel it's fuzzy? What is it? It's a thin film of plaque over your teeth. And this has to be brushed away daily with proper brushing technique. Now, if you're consuming too much of sugary diet or sticky diet, so the sugar from the food plus your bacteria from the plaque, that leads to formation of acid. And this acid is going to attack our teeth, the healthy teeth, and create a hole or a cavity in them, which is then known as a dental decay or dental cavity. So how does it manifest in all of us? We feel pain when you're chewing on something. You feel pain while taking sweets, cold food, hot food. You have complaints of food getting stuck in your teeth. All right. So now, if this decay is limited only till the enamel and dentinal part, we can usually take care of this by means of fillings, which can be the silver amalgam fillings or the tooth colored fillings. However, if the infection has reached beyond the dentin to the pulpal level and to the periodontal level, what happens is you need to go for a root canal treatment. What is root canal treatment, friends? Basically, we are filing away the root canal space after removal of the infected pulp, and we are filling it with some kind of a plastic material, usually called as gutta percha. And then over it, we place a crown. So now if you don't do this type of a root canal treatment, you land up with abscess. Okay, that is pus formation at the root end. Okay, so sometimes, the kids and the adults, they manifest with extraoral swellings in the cheek area. So it's mandatory that we go ahead with the root canal treatment in such cases. And as shown, as you can appreciate, the infected pulp is removed. It is cleaned and shaped biomechanically by means of dental instruments called as files, and then a crown is placed over it. Okay, so it's mandatory that you have to go for a crown after root canal treatment, otherwise structure becomes brittle and it's prone for fracture. So this is how it looks on the dental radiograph, the IOPX. Okay. So if you see the left side figure, you can see how the sixes, the first molar, there is a decay, and how with proper root canal treatment, it has been obturated, and the tooth, the bite part is what I mean by obturation. The tooth has been properly clean shaped, and the patient is free of any kind of disease right now. Now, how can you avoid getting such kind of cavities, whether it's an initial cavity or, a proper decay which, has involved pulp? So first and foremost things, please avoid sugary foods. Please avoid frequent snacking, your carbonated beverages like soda, your Coke, Pepsi, all those things. Okay, limit your snacks throughout the day. The frequency is really important. And yes, you may think that how to say no to the young kids. So to begin with formulating a good oral care regimen, it's important you give once weekly, one yes day to the kids. Okay, let them eat once weekly. Don't deprive them. But gradually, when they understand the importance, you can gradually, do away with the habit. If not all at one go. Okay. So with the change in your fooding habits, snacking habits, it's important that all of us brush twice daily with a fluoridated toothpaste and a soft bristle toothbrush. Please do not go for a medium or a hard bristled toothbrush which are available in the market. We need to emphasize the bristles have to be soft, and the duration, usually the parents ask, how long should we brush? Is it 10 minutes, 5 minutes, 30 seconds? No, minimum of 2 minutes. That's enough. And every 2 to 3 months, the toothbrush has to be changed. Apart from this, if you regularly floss in between the areas of the teeth where your toothbrush cannot reach, it really helps removing those food particles and buildup of plaque, and followed by acid attack by the sticky and sugary food. Now, apart from these fooding habits, your brushing habits, if you go to a dentist, specifically the youngsters, the kids, because they may not have the dexterity to do the brushing properly, especially for the rear teeth, which are your molars. So in those we can apply sealants. What are sealants? They are plastic material which are placed in these groovy pits and fissures that you see. Okay, the chewing surfaces. So then your teeth is not prone for any kind of accumulation of plaque over the tooth surface, because that groovy pits and fissures have been sealed by the sealant. Okay, so that's one way you can avoid getting cavities. The second way is you can go for fluoride varnishes. Okay, they actually strengthen the tooth enamel and they make it more resistant to tooth decay. So that can be done professionally, and at home you can buy a fluoridated toothpaste, but a professional fluoride application with the impression trays, that actually helps a lot. So if you have a combination of sealants and fluorides for your teeth, at least the deciduous teeth, initially when the child is young and he does not know the entire oral care regimen, it provides a good amount of protection to the oral cavity. Now, another important thing which is important for our young generation, the newborns, are nursing bottle caries. Now, this is with special emphasis to the new parents who actually don't know that making a child sleep with a bottle which is filled with, milk, sweetened milk, Or let's say if you're giving a pacifier to a child which is dipped in honey or any sugary stuff, even the breastfed infants whose gum pads are not wiped off prior to sleep, all of them are at equal risk of developing nursing bottle caries. How does this look? It usually affects your, babies who are 1 to 2 years of age. And as you can see, the upper front teeth, they are totally decayed, and it's a very, very difficult situation for the parents as well as the youngster not to have teeth at such a, tiny age. So the moment you see white spots and some kind of a brownish discoloration, it should alert you that your child might be going for the development of nursing bottle caries. So as parents, what we have to be careful is, after making your child, first of all, don't use the bottles. Okay? And if at all your child is using it, let him not sleep with the bottle. Okay? You clean the gum pads of the child by a gauze. Okay? And pacifiers should never be placed while sleeping. Okay? And what else can you do? You can, if the child has a habit of, taking the bottle and then sleeping at night, you can fill it with plain water. But please, absolutely no milk, sweetened milk or honey or sugary drink. And it's best to wean the child from the bottle in a timely manner. Okay? So begin a good oral mouth care regimen right from the time your primary teeth erupts. Okay? You see any kind of discoloration, the brown spots, the whitish spots, please go to a professional checkup. So that was about the dental cavities or caries and your nursing bottle caries, which affects our younger lots. Now next, moving ahead with the irregular teeth. Okay. Or in professional language, we call it as malocclusion. Now, early loss of primary teeth, that can cause malocclusion. Okay. Now, if your milk teeth, they are lost at a very early age and they're not replaced by the permanent teeth, okay, they might become crowded, as you can see. Sometimes there might be too much space between the teeth, which is called as spacing. Sometimes your lower jaw might be, more buccally placed towards the cheek as compared to the upper teeth. So, which is called as a crossbite. So when you see all of this, irregular teeth, crossbite, spaced teeth, teeth not well aligned, or if you notice your child's lips are not coming in proper contact, he's lisping, he's not able to pronounce the words clearly, okay? Or if at all the parents also have a history of orthodontic treatment, please go and seek dental advice, because it's very likely with all these factors, your child needs care at an early age so that he can get well aligned teeth when all of his teeth erupt. So your orthodontist may actually provide him certain kind of appliances, okay? And he may actually also give you certain braces. So you can have metallic braces, you can have ceramic brackets, and it can be placed towards the inner side of your teeth also. So because many of these kids, specifically around teenagers, they're very conscious about looks if they're wearing braces. So you do have an option of Invisaligners, your ceramic brackets. So that should not be an issue, but correct treatment at an early age, early intervention is really what makes the difference. Okay. Now, if there are certain habits also present in your child, like, continued thumb sucking beyond, or let's say 4 years of age, or if he has a persistent tongue thrusting habit, or nail biting habit, or any other thing, we have to ensure that you go to a dentist and he will give you an appliance, something that you see in the figure, something like a crib, which is a habit breaking appliance. Otherwise, there is a lot of dental malocclusion and other deformities, something like an open bite that you can see in the diagram. Okay. So we need, really, as parents, we need to be careful, because kids at such a young age may not know the consequences. But as parents, as teachers, this is an alarming sign if your kid or if your student is doing that. Okay. Early intervention, your habit breaking appliances are mandatory. Now, the next thing that is important for kids, specifically the ones who are ones with the deciduous teeth, most common is the anterior tooth injury, the trauma. While playing, the kids might fall down, or there might be some sports. So parents, all of us, we should be aware that we have something called as orthotics or splints, mouth guards, which actually protect our teeth when you're engaging in contact sports. But of course, all of us are not wearing this while playing. So we should know, we should be educated that what if a tooth knocks off? How do we save that tooth? Okay. Now, first thing is, if it's a milk teeth and the kid is really small, please do not try to put it back in the mouth. There's a danger of swallowing it. Only if it's an adult tooth, the kid is mature enough, you can hold the tooth by means of the crown portion, as you can see. Never ever hold the tooth with the root part. Otherwise, it can damage the membrane, which actually secures the PDL fibers, which secure the root portion to the gums, to the underlying bone. So hold it correctly, and if you have to store it just in case, please do not leave it dry, because leaving it dry is actually very, very detrimental to the preservation of the periodontal ligament that we are talking about. So the best storage media, which is easily available at home, is something that matches the pH and osmolality of the oral cavity. So that can be your pasteurized milk, it can be even egg white, your coconut water, and professionally we keep it in HPSS, that is the Hanks balanced salt solution. There are many other storage media available in the market, but the key point here is, please do not leave it dry, do not hold it from the root part. If you timely approach your dentist, that there is 85% chance that your tooth will be saved. Okay, the avulsed tooth which has come out because of trauma, it can be saved. Now, those were the problems which were concerning mostly the younger lots, I'll say. Not that they do not affect the adults, but generally what we see, the problems are more, the bottle cases, more prevalent for the young diseases, or in professional language we call as periodontal diseases. Many of you might be addressing it as pyorrhea, or the bad breath, or bleeding gums, anything. Now, what exactly is it? Why does it happen? Now, this usually happens when you are not brushing correctly. Now, if you don't brush correctly, what happens is it builds up a bacterial film, which is called as plaque around it. Now, when minerals from the saliva combine with plaque, that develops into calculus, or what you call tartar in regular language. Okay, and unlike plaque, which can be brushed away daily with a correct brushing technique, you cannot remove calculus. You have to visit your dentist to get that calculus removed professionally. So when you have these plaque and calculus in mouth, you will have a cascade of events which are taking place. You will have bleeding gums when you're, chewing food, or you are brushing, or you may complain of bad breath. You may have swollen, red, tender gums. You may have receded gums, like you can see in the diagram, the gums being pulled away from the teeth. And you may notice, there is a gradual increase in spacing between the teeth, or sometimes even mobility and tooth loss. So such a plethora of events can take place if your gum health is not maintained properly. And mind you, friends, over the age of 45, most of the time the tooth loss is because of these periodontal disease. So how do we take care? Of course, what we've discussed, proper brushing technique, proper flossing, and apart from this, you do need to visit your dentist twice a year minimum to get professional scaling and polishing of teeth done. Okay, because if it is plaque, yes, of course you can manage at home. If it is calculus, no matter how much brushing you do, it will not go away. It requires professional attention. So do visit your dentist for scaling and polishing at least twice a year. So after periodontitis, another most common thing which we see is oral cancer. Now, this is specifically in relation to the adults. I will say that if you notice any kind of a lip or a mouth sore that doesn't heal, or some white patch, or let's say a red patch, if you have some growth or lump inside your mouth, any sign that bothers you more than 2 weeks, please go for a dental checkup. Your dentist will do a biopsy and confirm that it's not oral cancer. Because early intervention again is important. Your treatment is also, the success rate, the prognosis is really good if your treatment is started well on time. It'll be same like the cancers of the rest of the body. There will be resection of the cancer, which will be followed by your radiotherapy and chemotherapy. And if you don't start on trying the treatment, the mortality rate is very high. You actually lose the patient. So with all these habits of tobacco chewing, smoking, alcohol, these actually are very very unhealthy for us in a longer run. So there are a lot of complications which can arise due to oral cancer. Now, you may have to, go for resection of the entire maxilla, the upper jaw, the entire mandible. Patients might lose their tongue, and it's really a very, very uncomfortable situation because with oral cancers, your entire quality of life gets affected. You cannot eat, you cannot speak, you cannot drink. Socially, it's very embarrassing to face. I'm telling you the mindset of the patients. So early intervention, regular checkup is the key to saving our patients and having a good prognosis for the case. So even apart from these growth and lumps and patches, if you see there is a difficulty in tongue movement, or there is a sudden hoarseness in your voice, or there is a radiating ear pain for unexplained reasons, please do consult your dental surgeon. Of course, these etiological factors, what I just mentioned, it's a total no-no. If you are, doing any of these habits, please stop them because, life is more precious than anything else. Now, apart from all these dental problems, like we've discussed cavities, we've discussed gum diseases, we've discussed malocclusions, trauma, we've discussed cancer, we've discussed nursing bottle caries, and so forth. You also have to understand that our oral health is equally linked to our systemic health. Systemic health, the diseases inflicting the systemic organs, they have oral manifestations, and definitely their treatment will affect the oral health. And vice versa, like oral diseases will increase the risk of systemic diseases, and their treatment will also be affected. So it's a both way situation. There is a mouth body connection. Okay, mouth is the gateway to your body. So all your organs, your heart, your lungs, your multiple organs, they are directly linked to the oral health. Now, it's been clearly documented in our scientific literature that more than 90% of systemic diseases have oral manifestations. So, periodontal diseases and diabetes connection is well established. Your heart diseases and stroke connection is well established. Even your pregnancy outcomes because of the poor oral health, we'll be just seeing in the upcoming slides, it's well established. So let's start with the basic diabetes. Okay. So people with diabetes who have poor, sugar, blood sugar level, they are more likely to develop oral health problems, such as your gum diseases, the periodontal diseases. They will have dry mouth. They are more prevalent. There's more prevalence of caries in them. There is delayed wound healing. They may even have tooth loss because of mobility. They may complain of dry mouth and bad breath. And it's interlinked. If you have serious gum disease, the periodontal disease, it also causes your blood sugar to rise. And this makes it really harder for diabetes patients to control their blood sugar, because they'll be actually more susceptible for infections, and their body is less able to fight bacteria which are invading the gums. So it's a two-way connection. So your good oral care is really important in case of diabetic patients. Now, if you talk about heart diseases, you must have read in newspapers that dental diseases, uh, they cause heart attacks, or off and on. Sometimes we do read a paraphrase for such mishaps happening. Now, understand that oral bacteria can be absorbed into the bloodstream via your inflamed gums, the infected gums. And through the bloodstream, they're going to travel to the entire part of your body. Now, this process may lead to tiny clots or inflammation in your blood vessels that can lead to cardiovascular disease. Now, I'll give you one common example: patients with prosthetic valves. Okay. Now, in such susceptible individuals, if you have infected gums, and the oral bacteria actually travels through the bloodstream, and it occupies the lining of the heart valves, it causes inflammation in the lining, and then the patient may land up with infective endocarditis, and it is actually very mortality rate is very high, the morbidity is really high. So the evidence is clearly established that if you have a good oral care regimen, proper mouth care, you can actually decrease your risk of having the heart diseases. Likewise, if we talk about our respiratory health, okay, there is increasing evidence that poor oral care, that can, of course, it can have a multitude of oral manifestations, as you can see, in the form of ulcers, patches, changes in the tongue pattern. But apart from this, very important is that evidence of community or hospital acquired pneumonia, you know it is really very prevalent, especially in patients who are already medically compromised. So regular and effective mouth care to reduce the plaque, for reducing the amount of oral secretions, is actually mentioned as a preventive measure to decrease the risk and severity of pneumonia, because this kind of hospital acquired pneumonia is actually very fatal, and it extends your duration of stay in the hospital. So proper oral care again is very important in such patients. Apart from that, if we talk about, let's say, pregnancy, it's very commonly seen due to change in the level of hormones. There will be uh, inflamed, swollen gums. There'll be bleeding. There'll be pocket formation, food stagnation, even because of the change in dietary patterns of a pregnant lady, like resorting to more frequent snacking, or let's say any kind of frequent snacking in or sugary foods. So there is more incidence of caries also seen. So it has been linked that your preemies, your preterm births, are directly linked in patients with periodontal disease. Your babies will actually be born with low birth weight. So maintaining a good oral health while during pregnancy as well is equally important, because we don't want to pass on the ill effects, the side effects to our babies as well. So on a nutshell, I would like to give you little tips for a regular oral care regimen which should be resorted by each and every one of us, so that our teeth can actually last a lifetime. So you can do three things at home, friends. You can brush your teeth twice a day, morning, more than morning brushing. I would say the night brushing is more important, because that is when your salivary flow decreases, and we are more prone for getting the acid attack by the plaque which is adhered to the tooth surface. So twice brushing daily is mandatory. Now, when you talk about the strokes of the brush, please do not do it in a horizontal manner. You angulate your bristles of the brush at 45 degrees such that they, touch both the gums as well as the teeth. And special attention should be paid to the hard to reach molars. You give back and forth strokes, proper all sides, and you have to clean the inside part of the tooth also, as well as the buccal surface, the lingual surface, the palatal surfaces. All surfaces has to be brushed with great caution, because this is where your plaque adheres over the tooth surface. So if you're leaving out any surface untouched, specifically your marginal gingiva area, the cervical area of the tooth, which is near the gums, that is where all the problem starts. So start angulating your brushes at 45 degrees to the tooth structure, with half the bristle on the gums and half on the tooth, and using correct strokes all over is very important. Even children, you should know they need oral care. So, of course, it's difficult for the children to monitor such kind of brushing technique, but at least in the beginning, to begin with, you can teach them circular technique, okay, as shown in the figure. So, the habits that you inculcate in your kids right from an early age, they last for a lifetime. So, even if the teeth has not erupted, the gum pads of the kid, your infant, they can be cleaned with a wipe gauze, the wet gauze piece. Okay, so don't think that primary teeth are just temporary teeth, because they are actually the space holders for permanent teeth. You don't take care of your primary teeth, it's very very directly linked that your permanent teeth will not be in correct alignment. You actually have to give space maintainers if your teeth are lost well ahead of time. So we need to take care of primary teeth equally. So you can use fluoridated toothpastes even for the children. The young kids, when the teeth are erupting, we can also advise them tooth mousse, so that the post-eruptive maturation is really faster for those teeth and there is less evidence of decay. Now, apart from this, we can also include mouthwashes in our regular regimen. Now, please understand these are just adjuvants. It's not a replacement for your correct form of brushing. Yes, they minimize the bacterial count and they do help in controlling the disease, but don't take it as a alternate to brushing. It has to be done in totality: brushing, proper flossing, proper mouthwash, and apart from this, you also have flossing technique. I'll tell you. You have to, if you're using a loop of floss, it has to be winded across your fingers and then taken up and down motion in between the tooth surface. Okay, that's the correct way, which has to be done in between all the teeth to remove the food particles in between the teeth. And not only your teeth part, even your tongue part. Okay, you should use a tongue scraper, okay, to drive away all the bacteria which may lead to foul breath. Even your brushes nowadays, they have provision for cleaning your tongue. So this entire regimen has to be followed very, very diligently. Okay, so that you don't land up with any kind of gum diseases or cavities which are more prevalent. Apart from this, your after every meal, it is mandatory that you rinse your mouth, gargle, and spit. Okay, please do not let the food particles stay over your tooth for a longer time, because that is when the entire cascade of events happen: the bacterial attack, the acid production, the softening of enamel, and all those things leading to cavities. So rinse your mouth properly after every meal. As for the diet part, I already told you what to avoid. You should eat a balanced diet which comprises good amount of your carbohydrates, good servings of proteins, your vitamins, minerals, and minimal amount of your sugary and sticky food. Okay, so well balanced diet along with water, of course, it's a very important component of a good diet, should be incorporated in our day-to-day regimen. So habits, harmful habits like any kind of thumb sucking, tongue thrusting, nail biting, all those things, and tobacco consumption in various forms, alcohol consumption, all these should be avoided to land up into any kind of diseases that have been mentioned in the previous slides. So with this, I conclude my presentation. Correct form of home care regimen and early intervention, as in regular visit to your dentist at least twice a year, is what keeps your oral cavity along with the rest of the body in a state of good health. So with this, I conclude my presentation. I hope it has added up to your knowledge and you've gathered some amount of, takeaway message what I wanted to communicate. Thank you.
Thank you, Mom. Mom, that was very enlightening. And now I would like to remind everyone that you can ask your questions in the live chat. So, and we will gladly convey them to Ma'am, and Ma'am can answer them. Ma'am, we can have the first question. There was one in the audience saying that they have a problem of crowning of teeth. So, if you can just explain, like, what exactly is the crowning of teeth, and what can they do to
Yes.
prevent or like help against it?
See, are you talking? No. If I'm crowning of teeth, are you talking about the dental crowns and bridges that are given over the root canal treated teeth? Can I just have an elaborated version? Problem as in what? You're having foot lodgement. You're having. What do you want to ask exactly?
Mom, right now all the person asked was they have a problem of crowning of teeth, so we can assume that it's because of the.
See, I'll explain. See, when let's say patient undergoes root canal treatment, as I already mentioned, wherein you have to remove the infected pulp, it has to be given a cap or a crown over it. Another instances wherein you require these is case where you have missing teeth. That is when you prep the adjacent teeth. That is called as a bridge. The fixed partial dentures. So, in case your tooth height is actually compromised, that is where the problem lies. So, your dentist, so for your crowning, you should ideally go to a prosthodontist. I don't know if my audience is aware that we have 9 specialists in the branch of dentistry. So, a prosthodontist is the one who specializes in fabrication of crowns and bridges. So, the correct margins of the crown, correct axial height, your correct functional bevel, the contours, proper contact of the tooth, proper occlusion, if all these are taken care of, definitely there should not be any problem with the crowns of the teeth. If there is any other thing the person wanted to ask, I would be happy to answer.
Sure, Mom. I'll just say this to the audience once that next time, like, try to be more descriptive of the problem. And we just got it. It's saying I'm seeing multiple teeth erupting from same gum area. Is that something to worry about? Could you please
All
recommend
right.
some remedies?
Yes, yes, of course, it's something to worry about because what's your age? Can I know? I assume you must be in the mixed dentition phase, or can I know the age?
I think we can assume the age to be about teenagers, like 12 to 17.
Teenagers slightly. Okay, so that's when your teeth. See, each tooth has an eruption pattern. Like we start with our first molars or your lower incisors, we move on to the premolars, canines, and last is your second molars. Now, if you're saying from the same area multiple teeth are erupting, it looks like you have crowding. There is not sufficient space for your teeth. So you need to visit your orthodontist who's going to get it checked whether you need an interceptive orthodontic treatment, which means something like an appliance or maybe braces. That has to be evaluated. There are certain set of radiographs, your lateral cephs that need to be done. We take out the inference, what is the problem, what type of skeletal malocclusion is it, and accordingly formulate a treatment plan. So yes, it's a cause of concern. Sometimes even those extra teeth are supernumerary teeth also. So those are apart extra teeth, you can say, so they need to be extracted. So you need to go and visit your dentist definitely if you're having this problem.
Yes, ma'am, of course. I think that
The,
answered the question.
okay, thank you so much, ma'am, for your answer. Now, here's the next question. This is another doubt from our audience. The question says, I quote, are sweets and
All right.
ice really bad for my teeth? I repeat, are sweets and ice really bad for my teeth?
Sweets and ice. See, sweets, as I just said, yes, sweets are not good for your teeth. It combines with plaque. That is when the vicious cycle of the acid attack starts. The germs, the bacteria in your plaque, and the sugar in your food, that combines and produces acid, which leads to dissolution of enamel, the outermost layer. And that is when the process of cavity formation starts, the decay, the dental caries. So, yes, sweets are not good. If you're a frequent, if you have a sweet tooth, you're having a habit of, consuming that very frequently, then I think you should modulate your habit. And if you're eating any kind of sticky food off and on again, please brush immediately after that. We don't want any food particle to stay in the occlusion surface for a longer time, because those are the areas which hold back the plaque, the food particles and other things. Ice being bad to the teeth, I did not get as a question. Why would ice be bad for the teeth? It would be a little problematic for people who are having sensitivity. Now, sensitivity also occurs if you have receding gums, or if your enamel layer has worn out. That is when you start feeling the sensation of too much hot and cold sensation. So otherwise, apart from having a sore throat, I mean, you can land up with a common cold if you're consuming too much of ice. But in terms of teeth, I will not say. But yes, for sweets, definitely, I don't think so. It's
Of
a good
course,
option.
ma'am. That
Yeah.
definitely answers the question. Ma'am, we move on. We are moving on to the next question. I read another question. This is one of the questions from our audience. She says,
Uh-huh.
are dental X-rays safe and needed?
Safe and
I repeat the
needed.
question.
Yes, of course. Yes,
Are
of
dent-
course. It is needed. Because what you can see in the mouth is only the crown part. What is happening? We are not sectioning the teeth of the patient and actually checking histologically. So you need an investigation for it. So how do we check whether, let's say if it's a decay, or if it's, a problem of impacted teeth, or if there's any other problem without x-rays, it's absolutely safe. There is nothing to worry about. Yes, of course, the pregnant ladies, if there are parents here, for them, for teachers, yes, that time we do not advise any kind of, exposure. But otherwise, for dental treatment, absolutely safe. No need to worry about.
All
I,
right, ma'am. Thank
yes,
you.
ma'am. Ma'am, as we talk about brushing, would you recommend electrical toothbrushes or like manual ones? And for what age groups respectively?
See, I know it's quite in market is flooded with a variety of bristles, a variety of brushes. See, the electrical ones we usually advocate for. It's not that anyone cannot use, but someone with a limited manual dexterity. That means someone who's physically challenged, mentally challenged, who cannot understand your instructions how to brush properly. So in those cases, yes, electric brushes can help. But my personal suggestion is, without the proper brush strokes, with proper angulation to the gums and this, that's not a replacement. Definitely not.
Okay,
So
ma'am.
the amount of pressure you apply, that has to be taken care of. Don't apply too much of pressure. That will again cause a different set of problems. Cervical abrasions are very common in those who apply a lot of pressure while brushing. So for physically challenged, yes, I do advocate. But for people who are they can manage, I think it's absolutely fine. Go for a soft bristled. Check your bristles every 2 to 3 months and do the technique properly. That is more important. Don't go for the fad thing that it's electrical, my teeth would be more clean. No.
Okay, ma'am. Ma'am, as we know in the market, there are several toothpaste, right? And you mentioned that fluorides are required in the toothpaste for the teeth. Should you recommend
Yes.
like
Huh.
natural herb based toothpaste, or like these chemical based?
See, it's not chemicals. I would say, see, your toothpaste has got. First, I'll explain you why fluorides is important. That was your question, right? See, our tooth enamel, the tooth structure is having the hydroxyapatite crystals. When your fluoride combines with it forms fluorapatite. So, in simple language, what I mean to say is when you do fluoridated brushing, you're actually strengthening your enamel and causing it resistant for decay. So, point one is yes, fluoridated toothpaste are good for us. Now, if you talk about those herbal powders, it's a definitely no-no from my side because they have more of abrasives. In the paste form, it's absolutely not an issue, but please avoid any form of, tooth cleaning agent which is in a powder form. That's very, very detrimental to the, bearing away of the outer layer enamel. So fluorides are important. Your paste form is okay, and powdered in advertisements. There are multiple powdered forms versions also available. Please avoid those because of the abrasive content. So please avoid them. I can see one chat box message popping up repeatedly for sensitivity. What do you suggest? Is there a question from the audience?
Yes, ma'am. By Seema Sharma.
So for sensitivity, see, first we should see what is the etiology. So is your tooth worn off? So usually it occurs when the outer layer enamel goes off and your underlying dentin is exposed. So as I already mentioned, dentin has those dentinal tubules. So for sensitivity, it's better you go for desensitizing pastes and go for desensitizing your mouthwashes and get it checked. It can be a problem of receding gums also, or it can be multiple reasons can be there. So for home care, over the counter products, you can go for desensitizing paste and mouthwashes and get it checked what is the reason. Okay, so that is the protocol which we follow.
Yes, ma'am. Ma'am, we have another question by Vivek Sharma. He's saying that
Yeah.
kids, like especially in the age of maybe 10 to 12, should they use hard brushes or soft brushes?
Yeah. Soft brushes. Hard brushes are not advocated at any age. The bristles has to be soft. I repeat again, let it be soft bristled, brush for 2 minutes, and the amount of toothpaste has to be taken peanut size. Don't take the entire length of the bristles. That's not recommended. Okay, a peanut sized toothpaste, soft bristles, change it every 2 to 3 months if your bristles flare off, and do a correct technique. That is what is important. And night brushing is more important than your morning brushing. That I repeat again. Brush twice at least.
Ria, let's take the next question.
Yeah.
Of course. So, ma'am, the next question says, what's the best way to whiten my teeth?
Whiten your teeth. So, first of all, you should know why do you need whitening? As in, are you a smoker? Are you having any habits by chance, like chewing? I'm not talking to the student in particular. In general, first of all, you need to find out the etiology. It's an intrinsic pigmentation or an extrinsic pigmentation. So, what is the reason? Then, of course, we have bleaching as an option. So, you can visit your dentist and first, before treatment, my point of interest is always the etiology, why it happens. Remove the causative factor and then do the treatment so that it stays on for a longer time. So if you're a smoker, definitely you'll have stains on and on again. If your overlying enamel has worn off, underlying dentin is little yellowish in color. That can be one reason. If too much of tea stains, coffee stains, as I mentioned, those tobaccos in powdered forms, various forms. So first rule out the etiology, what is causing it. Sometimes it is there staining by birth as well. Tetracycline staining, wherein if the mother is taking the medications, it crosses the blood placental barrier and it affects the child. So if it is an intrinsic pigmentation, yes, you'll have to go for veneers as an option. Veneers, by veneering we mean, covering the front part of the tooth with some kind of a porcelain ceramic material for good aesthetics. And if it is due to the habits, discontinue the habit and go for bleaching. That can be done.
Okay,
Okay,
ma'am,
ma'am.
that definitely answers the question. I believe those were all the questions from the audience.
All right.
All right.
Ma'am, I personally have a question. It's
Yeah,
saying
please.
you mentioned something about genetics, right? How that gum
Yeah,
diseases and
yeah, yeah,
cavities and irregular teeth can be mentioned, can be passed on by a
yeah,
parent.
yeah,
So, like,
yes.
is it for true for gum diseases also? Like, I know for regular irregular
Yes,
teeth,
of
it's there,
course.
and braces can help.
Everything. Genetics has a role to play for every system of our body. It can be linked. Of course, there are environmental factors like how your diet is, how your or daily care is. But yes, genetics do have a direct link. Like for example, if you have a family history of hypertension, diabetes, definitely you have to be a little more careful because the genes can be passed on to you as well. So for everything, everything starts from DNA, RNA, and our genes. So definitely there is a direct link. If your parents have had a problem of crowding, problem of procline teeth or an open bite or anything, definitely those genes could have been passed on to the kids. So we need to be careful. But yes, with our proper care regimen, it can be taken care of. But that risk factor that is always there.
Okay, thank you, ma'am.
Perfect.
Ma'am, we have one last question from the audience.
Yeah,
It's
please.
saying that for children, is bleaching safe? And like, I want to add to that. What age would you recommend like braces and bleaching and dental exams, like these things, to be done?
See, dental X-rays can be done at any age, right from the childhood, even and youngster can go if there is a problem. Related to your orthodontic treatment, the best would be the mixed dentition phase. Mixed dentition means when in your the student has a mix of milk teeth as well as your permanent teeth. Somewhere around, let's say, 8 9 years of age, that is an ideal age before your jaw growth is completed. That is when your body responds maximum. So initially there might be an interceptive orthodontics, then they might resort to depending on the problem. So anytime when your permanent teeth starts erupting and you see there is a problem towards 8 and 9, usually the 9 is called as the ugly duckling stage, when in your your all teeth are in a maximum misaligned state. So I would recommend, see, the best time to visit a dentist even before the tooth is erupted. Some kids are born with the natural and monatal teeth. I don't know if you're aware, which causes difficulty in suckling. So those have to be removed. So it's not that once you're 8 years old, only then you have to visit the dentist. It should start even before your teeth have erupted. Related to ortho part, yes, you have to keep a tab. Like uh, usually we recommend starting from 8 to 9 years. Regarding bleaching, kids, why don't think so? Kids require bleaching. That's what I was talking about. The habits. Are you resorting? Are you into some kind of fooding or drinking habit which is causing the stains? Or is it an intrinsic stains? Maybe as I mentioned, some kind of medication stain, or is it because of or is it some kind of syndrome associated or thing. So bleaching for students at such a young age, I will not recommend until and unless first the cause has to be found out. So not in-house bleaching at all for those kids. No, without
Yes,
finding
ma'am.
out the etiology as to if I could actually know. I will say a total no. No, first the etiology has to be found out regarding the causative factor for discoloration. Only then we resort to the treatment. So without finding the etiology, I will not recommend directly jumpstart or purchase an in-house bleaching kit and do it. No, please don't do it. You visit, go for a professional checkup, find out what is the reason. I told you there are multiple treatment options. You can go for veneers, you can go for bleaching is an option, but first the causative factor, the etiology has to be found out. Why is there a discoloration? That is more important. I hope that answers
Yes, of
your
course, that
query.
answers question. Ma'am, also one thing that I would like to mention, as you
Yeah,
have already mentioned it in your PPT, that
yeah,
parents tend to ignore often though about to care about those primary needs of
yes,
children, and then it
yes,
later ends up with the crowning thing as you talked about. I
yes.
myself having braces around like
Okay,
a month or so I got them done. So these
okay.
things are these points
Uh-huh.
are needed to be inculcated in the children from the very beginning, and
Yeah,
parents should be teaching them. So I absolutely love that point, and I would like all the parents who are listening to this webinar
yeah,
must ensure that these
definitely.
practices should be
Definitely, as
inculcated in
teachers,
them.
as parents, as elder siblings, you have to watch out for the signs. If your younger one is complaining for pain on biting, if his teeth are, not spaced correctly, if it is too much crowded, if you see some kind of a spot, anything. So do not ignore anything. Go for a professional advice. Get it corrected at an early stage rather than it progressing to something, which is then taking a longer time and, so, early intervention and preventative regimen is what is important.
Absolutely, ma'am. Thank you so much, ma'am. Here we come to the end of the question answer session. Due to some unavoidable reasons, our principal, Dr. Upma Arora, will not be able to connect with us today. On behalf of ma'am, our
No
director
problem.
academics, Mrs. Nalini Bell, will be here to propose the vote of thanks. Thank you.
Thank
Mom,
you,
you're
Diya.
muted.
And am I not audible? Am I
Ma'am,
audible?
yes, yes, ma'am, you're
Audible now.
audible now.
I was just thanking you, children, for giving me this opportunity. And I must say that has been a great session for all of us, young or old. I must thank and congratulate Dr. Siddhi for an exhaustive, information and explanation. Believe you me, you've done a great job today. Bits and pieces we all know
Thank you.
things about, but the way you explained has been really, really, it's been an extremely enriching session. Thank you so much for accepting our, we wanted you to come and speak to us. So thanks a lot. And see, lots of parents have been asking for it.
Thank
So we thought we can, have for oral health. And I think you have completely justified there. They whatever they were wanted to know, they've come to know. I must tell you that even the takeaway, like you said, that definitely it has added so much to our knowledge, and the takeaway, like how to brush, and we are doing it, but then knowing more details, getting to know the consequences, and when to do and what is more important. Light brushing is more important. Twice it is important. Rinsing is important. These are small little things, but the other things like sugar and bacteria and acid and all these things we all know. But then thank you for reinforcing all that in us. It's been a very interesting and enriching session, believe you me. And thanks a lot for sparing your time.
thank you. Thank
And
you.
Dr. Siddhi she accepted our invitation, and she happens to be one of our esteemed parents. Thank you so much for this. We may trouble you again, some other session when we have
Thank you.
offline sessions with you. So, honestly, so this should be taken as
No,
a
no, that's
compliment.
absolutely fine. It's
So I must
no,
thank
thank you.
our teachers and parents and students for joining the the session, and a special thanks to these two children. The sweethearts,
Yeah.
the head boy and the head girl. They are the prized possessions of our school. And special and my thanks. I will not like to miss out the opportunity to thank even the IT department and Harmeet ma'am for extending their
Correct.
help. Thank you so much, all of you. We will definitely meet again. I personally feel that I've been benefited so much from it. So the other mothers and other students also have, the kind of questions that they ask. Can you imagine they're talking about bleaching? They good that you've given them the, actually what exactly needs to be done before we, actually take up these things, because these are very this is in vogue, smile and white teeth they were talking before the session. Anyway, thank you
Yeah.
so much, and love you, Dr. Riddhi. Thank you so much.
Thank you. Thank you so much.
Bye bye,
And
everyone.
from our side also, ma'am, thank you. And thank you to everyone in the audience. It was truly a wonderful
Thank you.
session.
You've
And
been a wonderful host.
Really enjoyed it.
thank you, ma'am.
Really enjoyed it. Thank you so much.